warahmatullahi wabarakatuh. Good morning everyone.
My name is Arta Mevia and I will be playing the role of the radiographer.
My name is Putri Citra Rafida and I will be playing the role of the patient. Okay, in this video we will demonstrate the standard procedure of hand X-ray examination following professional radiographic practice. The demonstration includes patient identification, communication, preparation before the examination, and patient positioning. We hope this roleplay helps illustrate the correct workflow and communication skills required during a hand X-ray examination. So, thank you for watching.
Good morning, Miss. Welcome to the radio department. My name is Nova and I will be your radiographer today. We will taking care of you for X-ray examination today. How are you feeling?
Good morning. My hand hurts a little after I fell, but I'm okay.
I'm sorry to hear that. Don't worry, I will help make this examination as comfortable as possible. We will take some X-ray image of your hand so the doctor can see if there is any injury.
Okay.
Before we begin, could you please tell me your full name?
My name is Putri Citra Rafida.
Could you also tell me your date of birth?
I was born at May 18, 2005.
Can you confirm your address?
My address at 25 Green Street, Selangor.
Okay, before we start, let me check your referral form. According to your doctor's request, we will be taking an X-ray of your right hand to assess for any possible fracture or other injury. Is that correct?
Yeah, that's correct.
Okay, before we continue, I need to ask a few questions. Is there any possibility that you might be pregnant?
No, miss.
Have you ever broken your hand or fingers before?
No, miss.
Wearing any rings, bracelets, or a watch on your injured hand?
No, miss.
Have you ever had surgery on your hand or wrist?
No, miss.
Do you have any metal implants?
No, miss.
Great. Can you tell me what happened?
I slipped while playing basketball during PE class and landed on my right hand.
When did it happen?
About an hour ago.
Where does it hurt the most?
I think in my thumb and the back of my right hand.
Okay, please leave your bag and personal belongings on the chair. You only need to bring your referral form with you.
Okay.
Thank you. Okay, today we will take X-ray image of your hand from different angles. Each image only takes a few seconds. The radiation dose is very low and considered safe. The examination is painless, but placing your injured hand may feel uncomfortable. Please keep your hand completely still during each exposure. The entire examination will take about 10 until 15 minutes. So this is the X-ray table and this is the image receptor. When your hand will be placed, the X-ray tube above your hand will be produce the X-ray. Please don't worry because the exposure only lasts for a fraction of a second.
Will the radiation hurt?
No, only the positioning may feel uncomfortable.
Is the radiation dangerous?
No, the amount is very small and we always follow radiation safety principles.
Will I know the results today?
The radiologist will review your image and your doctor will explain the results.
Do I need an injection?
No. Okay, please stand next to the X-ray table. Place your right hand flat on the image receptor with your palm facing downward. Spread your fingers slightly apart and keep your wrist straight and rest your forearm comfortably on the table. Please keep your hand very still, just like a statue.
Like this?
Perfect! Please don't move. 3, 2, 1, don't move. Okay, we will take another image from a different angle. This helps the radiologist examine your hand more accurately. Please rotate your hand about 45 degrees outward. I will place a sponge under your hand for support. Keep your fingers relaxed and slightly separate. Please stay completely still.
Okay.
3, 2, 1. Excellent! That's all the image that we need. You can relax your hand now. I will check the image.
This radiograph is a posterior-anterior or PA projection of the right hand. Overall, the image demonstrates adequate radiographic quality for the assessment of the bony structures of the hand. Firstly, patient identification and laterality are correct as indicated by the right side marker. The entire hand is included within the field of view, extending from the distal phalanx to the distal radius and ulna. Appropriate collimation has been applied without unnecessary exposure to surrounding tissues. The image shows good exposure and image contrast. The cortical margins and trabecular bone pattern are clearly visualized, while the surrounding soft tissue are also adequately demonstrated. There is no evidence of motion blur, indicating that the patient remained still during the exposure. In terms of positioning, this is a true PA hand projection. The metacarpal phalanx, carpal bones, and the wrist joint are well demonstrated. There is minimal rotation, as shown by the relatively symmetrical appearance of the metacarpal shafts and the appropriate visualization of the joint space. Most interphalangeal and metacarpophalangeal joints are adequately visualized without significant overlap, which is consistent with acceptable positioning criteria. Regarding the pathology, there is an obvious fracture involving the thumb. A disruption of the normal cortical continuity can be observed, indicating a fracture of the first digit. The fracture line is visible with associated alteration of the normal bony alignment. No cross dislocation of the remaining metacarpophalangeal or interphalangeal joints is evident on this projection. The remaining metacarpal bones, phalanx, and carpal bones demonstrate preserved alignment without additional obvious fractures on this view. However, because thumb fractures often involve complex anatomy, additional projections such as dedicated epithumb, oblique, and lateral views are recommended. These supplementary projections help evaluate fracture displacement, angulation, intra-articular extension, and possible carpo-metacarpal joint involvement, which may not be fully appreciated on a single PA hand radiograph. So, for the conclusion, this image fulfills the essential radiographic criteria for a PA hand examination, providing adequate visualization of the osseous structures while clearly demonstrating the thumb fracture. Nevertheless, further dedicated thumb projections are required for complete fracture assessment and treatment planning.
Everything looks good, so we don't need to repeat any image. The radiologist will review them and your doctor will explain the results. Please avoiding putting too much pressure on your hand until you've seen your doctor.
Okay, thank you very much, Miss.
You're welcome. Take care.